that's, of course, you, Russell Rensburg, and we're going to be looking at a health crisis unfolding here in South Africa. Thank you indeed for your patience. And let's talk about this crisis. Worrying indeed. You are the director of Rural Health Advocacy Project and also project director for the TB Accountability Consortium. A very good morning and welcome.
Good morning, Julia, and thank you for the invitation.
A very concerning situation, is it not? Because not only are you the director of rural health, and you're going to talk to us about this health crisis unfolding, it will, of course, have a direct impact on TB cases in our country.
Yeah, it's an evolving or perpetual crisis. So in South Africa, inequality remains the binding constraint to our development. And I think over the last 30 years, while we've made some gains, our child support grant and other types of social assistance actually have quite wide coverage. But our diet transition and sometimes the lack of things is contributing to a hunger crisis. And while I can't talk explicitly about the hunger crisis because it's not an area we're involved in, something we can do is really talk about the impact of good nutrition on health outcomes. And I think these are wide. Most importantly, on children. The country each year, around 1 million children get born in the public sector, so we know it's significant. But in the first 1,000 days, good nutrition has a lifelong impact. It leads to good brain development. It means those children can eliminate stunting, something that the president spoke about. And also it impacts on future economic participation. So the rough calculations from global agencies suggest that if we just invest 17 Rand in good nutrition, we get a whole 391 Rand back in good value and economically active participants in our economy. And I think we desperately need that. The second component is vulnerable people, particularly people living with tuberculosis. So one of the issues with tuberculosis, or one of the symptoms in how TB disease presents, is really rapid weight loss, right? Which impacts the body's immune system to fight the disease. And when we enroll people in treatment, and we do that relatively successfully, right? One of the things that we need or will contribute to good TB outcomes is good nutrition. And that's not always available. And it could indirectly be contributing to people not completing their TB meds. And as a result, we have this almost over 56,000 deaths annually from TB-related causes. So I think the situation is quite complex, and it's something that lawmakers, particularly now when we have a coalition government of sorts, where lawmakers can go back to the table and start figuring out how can we better respond to the prevailing situations in our country, not just for inclusive economic growth, but also to give life to the provisions of Section 27 of the Constitution, which includes not just access to healthcare, but also to food and social assistance. Thank
you. There used to be a school nutrition program that was not only rolled out in rural areas, but in all government schools. And I firmly believe that something like that needs to be reintroduced unless it already is in action. But also, we're talking numbers here, we're talking huge amounts of money. If it's not happening currently, what's stopping it from happening? Number one. And number two, undoubtedly, the aid cuts by the US government and other such agencies is having a very direct and hurtful impact on our rural communities in South Africa. And then, of course, it speaks to the rest of Africa and other third world countries.
Look, one of the greatest successes we've had in our country is really Section 28 of the Constitution, which is the rights of children. And by virtue of that right, we have a very successful or widely expansive school feeding program. I think the question is it enough? Is it standardized across different provinces? It covers one meal. Is that enough? When children are not in school, are they always consistently able to access it? And I think this is one of the challenges. in the policy tools that we have ahead of us. But like they say, financing is always the constraint. And I think one of the recommendations we make is that we look at, the taxation of harmful products, particularly alcohol, tobacco, and sugar-sweetened beverages, as a mechanism to raise more revenue. And that revenue will help us as a country to maybe invest a little bit more in early childhood development programs, in making sure as we expand to grade R and grade RR and so on, that school feeding programs are available to those children. I think that will contribute a lot to reducing child hunger. And also maybe have another relook at our social assistance program. At the moment, we do provide child support grants to almost 80% of eligible children, but the amounts are not sufficient insofar it doesn't meet the basic food poverty line. And we need to really start thinking about how do we use all these different investments to protect the next generation. On the case of the American withdrawal from aid, it's very unfortunate, but we thank the American people for the 20 years that they've invested in the AIDS response, not just in South Africa, but around the world. And what we're going through now is maybe just a global readjustment. And I think it sends an important message that we cannot leave the development of our communities in the hands of donor funding. And I think this is another way where the progressive uses of the tax regime, particularly in South Africa, which is a really rich country, where we can have more domestically financed responses, so we don't create the risks that we experienced with the withdrawal of the American aid in January 20 last year. But it's in our hands. We are a rich country. We have the tools, health taxes. We have a government that's now made up of a more diverse group of people. That diverse group of people can come together and reimagine some of the things that we've done over the last 30 years and how we can improve them, because inequality remains a binding constraint. We continue to invest in the development of the 80%, be it healthcare, be it education. Our system still follows like the social gradient, when those with better resources, barring a few exceptions, dominate the upside of the development. And largely, people living in former rural areas or homelands are still the worst off, with the highest rates of unemployment, low school completion rates, and particular vulnerability of young women, as we see each year with the release of teenage pregnancy numbers, right? But I think what we need is an integrated solution, a district health system that responds to all our needs, and really putting good nutrition at the center of early child development and child health, along with vaccinations and all other things like that. So we have the tools, right? I think what we need now is the will and the intentionality to use the tools that we have available to avert this crisis from becoming a much bigger developmental crisis.
You speak about two very important things that has jumped out at me, and that is teenage pregnancies. We've been talking about it long and hard, and yet it doesn't seem to have made a dent. What is the flaw in that particular system that, despite all of our hard work and screaming from the rooftops regarding teenage pregnancies, it's still on the rise? And of course, this crisis regarding access to the most vulnerable of communities, you indicate the resources are there, but it really is dependent on implementation. And what pops into my head when you say that, when you made that statement, is the corruption that is so rife in our country. Any and every system that one looks at, it is absolutely bereft with corrupt officials and practices. If this was an ideal situation, ideal country that we're living in, and we didn't have this corrupt system at play, this would have been absolute nirvana. This country would have been a true nirvana to be living in. Would you agree with me there?
Look, I think it's certainly something we can aspire to, right? I think we have a very strong legal framework that advances the rights and it recognizes the injustices of the past. But corruption certainly is a problem, right? And I think it's the world over. South Africans or Africans don't have the monopoly. We can see what's happening elsewhere in the world.
True, I agree with
and
you.
Where money and power intersects, right? Be it public, be it private, there's corruption, right? And I think corruption is one of those risks that we need to solve for. right? And it's a risk that goes right through every particular system, from tendering, from political involvement, from oversight, transparency. And I think it's not something that's very easy to undo. We see one of the oldest democracies having a state capture corruption to the level that we didn't
True.
even have here, and quite.
Absolutely.
But the corruption is a problem, right? I'm not going to
Mm.
minimize corruption, but I think what we're solving for is good health, right? And in delivering good health, what we need to figure out is where are the corruption risks and how do we deal with that. And the first step we have to start is the legislative framework that allows it. At the moment, I think there are two very important reforms that this government can implement. The first is probably the Public Service Amendment Bill, which removes a lot of political involvement in key appointments and lays out a structured framework for the appointment of public officials in the public sector. I think that bill is currently sitting with the president. The second thing and I think 90% of corruption happens here, is in procurement reform. When we
Mm.
look at things like the Tembisa hospital scandal and the way that people, and even state capture more broadly, is that those who break the law know the law, right? And I think they've
Sure.
exploited loopholes in the system,
Mm.
particularly in Tembisa. We see this like the weak, something is meant to aid quick responsiveness was abused for a different purpose. And that is around like tenders around 500,000, where the rules are slightly different or the expectations are slightly lower than any amount above that. We saw that, for instance, a while back by one of the government communications persons for the Department of Labor. I think there was quite a furore around that, where they had one event with 3 different tenders and they were all under 500,000. So they were able to spend 1.5 million on something that actually contributed no value. But they did it within the context of what the procurement regulations were at that time. Similarly, in Tembisa, the vast majority of those transactions were tenders under 500,000, which allowed for quick passage through the procurement systems. So I think in the short term, those are the kind of legislative things that we can do. But we can't legislate corruption away. It's really about going back to our first values as a country, why it's important. And I think that's why it's so important that we no longer have a one-party rule, right? We have a number of different parties and interests within our government. And I think for us as a citizenry is to hold that government to account, not by party political positions, but by constitutional foundations. And I think our constitution allows for public participation right through the process. So we don't just simply hand over power to politicians. So unlike anywhere else in the world, I think here we have civic action, well directed and well resourced, can actually also contribute to minimizing inefficiencies and corruption within the system. But it's not a problem that's going to go away by us constantly talking about it. Again, it's something that we need to act. And I think in this instance, I'm actually quite pleased that one of the president's apex priorities in his State of the Nation speech was tackling organized crime. Right?
Mm-hmm.
I think it's the first time we put it straight on the table. And I think by saying that, we cast the net wide on everything, from corrupt politicians to corrupt businessmen to people abusing the system. And I think using all the state resources governed by a multi-party government will put us in the direction to sort of start building the country that we want, right? And I think as South Africans, we have another opportunity, another 1994. But now, informed by the lessons of the last 30 years, we can push for a reform agenda that addresses the foundational elements of or preamble of our constitution, which is about ensuring that all people who live here can live to their full potential. And we use the Bill of Rights, right, which is a very intentional act, to start actively working towards addressing inequality or the impacts of inequality on human development, right? And I think that's an intentional process, and that's how things are. We're not going to move forward with constant diagnosis. I think how we move forward now is using the precepts that we have more intentionally, building social support, and start working on building the country that we want. And I think the rights of children is an important place to start. So this priority on early childhood development, this priority on expanding ECD to grade R. And I think now important that the president also mentioned nutrition. And I think it's our job now as civil society organizations and civic groups to be intentional on the demands and how we can improve that. And I think you're right, the school feeding program, which is an existing program, we can expand from 1 to 3 meals a day, make it universal so that all children qualify and contribute to it. And children don't have to self stigmatize and opt out, which often happens where children are hungry, but they don't want to be associated with taking charity, so they don't eat, right? And if we make it universal, right, all children will benefit from good nutrition. If we give nutritious meals, we also lay the foundation for children to, sort of normalize eating nutritious meals, meals high in omega-3, meals high in protein and iron, right? And a balanced diet that will shape their future nutrition decisions. And I think at the moment we have this big transition, even amongst children that are better resourced, where we have hidden hunger or nutrient pure diets, but still obese children. So I think this is a crisis that unfolds on many levels. And we have an opportunity now to start coming up with some kind of consensus agenda and really focus on strengthening this issue from nutrition, early child development, and improving foundational learning. And I think that in the long run will contribute to better health, to better development, and so on. And we have the tools. And I think the most immediate tools is using these health taxes on alcohol. And I think it still shocks me that we spend, as a country, R1 billion a day in the run-up to New Year's Eve on alcohol. We spend 417 million rand a day on alcohol, right? And the benefit, and there's no very real material benefit to that. It leads to trauma, it leads to violence, and responsible drinking is an oxymoron. There's nothing responsible about it. And the binge drinking that we have at the moment is just unacceptable. And using the tools that we do have, like the taxes, can reduce consumption. And reducing consumption means we have reduced incidence of it, and less contribution to future health costs, and we raise revenue. Similarly with tobacco. Tobacco we've been relatively successful with. But for the first time in a decade, the people that are smoking are rising, right? And I think that's also not acceptable because tobacco contributes to expanding the incidence of cancer and almost every other health condition. Thirdly, sugar-sweetened beverages. We know from COVID, and many of us are still bearing the scars, particularly of the third wave, where many people in Johannesburg died from that particular virus because of underlying diabetic conditions. And I think consumption of sugar contributes negatively to the development of type 2 diabetes. So the evidence is clear, and these are direct measures that can raise revenue in the short term, that we can utilize on different aspects of the budget. And for us, it's really about prioritizing people living with infectious diseases, particularly those that are curable, like tuberculosis, HIV, where we have close to 6 million people on chronic care, but we only treat the HIV and not other health conditions, children and mothers in particular. And I think there's a tool here that we can use in the interim. It's not perfect, but it does lay the foundation for us to start building the country that we want, rather than reacting in a binary way to the maladies that beset us.
Okay, so the tool you're referring to obviously is good nutrition. We're going to have to leave it there. My next guest has already connected up, but I would like to leave you with a comment, and that is, I think you spoke very succinctly about the issue around alcohol, and that alcohol taxes must be raised to a point to where it will prevent people from consuming alcohol so freely. But at the same token, we need to look at the sugar taxes, the sweets and all the junk foods that is being advertised. It's shocking how they advertise it and make these products so attractive, even when you go and do your basic food shopping in the supermarkets. I too get hooked, and I end up filling my trolley with all the rubbish. And I think those are two areas that need to be looked at by foundations or organizations like yourself, and that is the advertising industry, and of course the food stores where they promote unhealthy foods in such a huge way. They catch you just before you get to the tills with this long, those long rows of sweets and goodies being advertised. So something for you to think about, and hopefully we'll tackle it in our next discussion. I do hope to have many more such discussions with you. Thank you, Russell Rensburg, Director of the Rural Health Advocacy Project, and also Project Director for the TB Accountability Consortium. A very short, sharp, quick answer from you to this final question. Are our TB rates dropping in the country, yes or no?
Yes.
Oh, good news. I'll take you up on that, and HIV and AIDS in a future program. So do be prepared for that invitation. Thank you indeed. God bless and go well.
Thank you. Goodbye.
Bye. It's 8:36.